This video clip is one in a series of three that really is going to point to what we think is an important concept to create a foundation for improving patient and family experience. And there are three segments, one for the hospital setting, one for office practice settings, and one for home health care. So I'm going to launch into what we think can be helpful in the hospital environment. Michael Berry and Susan Edgman-Levitan in 2012 published an article on shared decision making. And in that article, they had this sentence: enhancing conversations between patients and clinicians from what's the matter to also including what matters to you seemed to be a very important concept to those of us here at the Institute for Healthcare Improvement. Subsequently, we have been promoting this concept to a number of different audiences, both within the U.S. and internationally, and it seems to have caught on and deepening the understanding between clinicians and patients and their family members to what really matters, what's really important to them, that creates a foundation for genuine partnerships with patients and family members. So asking that specific question, what matters, is not as important as the relationship. The genuine attention to the patient and their family members, and genuinely really spending time, and as in this picture depicts, between a clinician and a patient here, that really there's a genuine interest in really understanding more deeply what's important to that individual. Last year, Jen Rogers, a nurse from Scotland, heard Maureen Bisignano, the CEO of the Institute for Healthcare Improvement, encourage clinicians and staff to ask about what matters to their patients. Jen works on a psychiatric unit with primarily children with autism. And when she returned to her unit, she asked the children there, gave them a piece of construction paper and asked them to write or draw what matters to them. And Kendra, the one little girl who was 7, said, "I don't like medicines by my mouth, watch out." And that I'm very fast and I'll run away. And that I love cuddles. And that she can dress herself with some help. So you can see from that example that, really understanding those deeply personal things about that child really helps the staff and clinicians to really customize care and really meet that child where she is. Here's an example from a hospital in Detroit. The whiteboards serve as a communication vehicle to enhance communication between the patients and families and the staff. And this white box at the bottom here, they actually converted to really a section of the whiteboard where they asked patients and their family members when they were going home, did they have any worries or concerns about going home? And there's two examples that really stuck out when I shadowed one of the nurses who was doing this before she went into multidisciplinary rounds. First was a young man who was on multiple medications, and when he was asked this question, what he told his nurse was that he really could only afford 3 of the 6 medications that were being prescribed to him, and he really didn't know which ones were most important. Well, that's extremely important information that probably that team did not know when they prescribed those medications and actually educated him about what the importance of each of them was and how to take them. So this information was then taken to the multidisciplinary rounds, and they discerned 2 things. They were seeking financial assistance for this man so he could afford all his medications. In the meantime, the hospitalist went to meet with this man and sat down and went through the medication list and decided actually which ones were most important in the first couple days after discharge, so that they would be making that collaborative decision as opposed to him just randomly making his own decision based on perhaps price or just which ones he might have had at home. The second example was an elderly woman who, when asked this question if she had any worries, thought for a minute and said, "Gee, Well, I'm not sure I'm going to be able to make the appointment with my primary care doctor in 2 days. And so the nurse inquired further, well, why is that? And she said she didn't have a ride, that her son had been taking off a lot of time from work, taking her to appointments, and now he didn't have as much time to take off for work. So the nurse said, well, can you take the bus? And the elderly woman said, I'm worried about going out of my neighborhood alone. There's been a lot of shootings. So the nurse took that information to multidisciplinary rounds, and really that's not something that's within the power of that nurse to fix. So consulting with the greater care team was important, but they actually didn't have an immediate answer either. But they took it to their hospital level transitions and care team and work with their community providers within the community and people that were in the community and agencies in the community that were working with them. And what they developed was a volunteer squad to go to certain neighborhoods and volunteer to take patients to appointments. So you can see that asking the question may not be, the person asking the question at the bedside may not be the one that can solve the problem, but taking it through all the processes within, in this case, in the hospital, really helped over the next couple months to not only help this woman, but help others. So asking these questions really revealed a lot of things that may not have been apparent in the regular care plan. So what if every clinician and hospital staff member routinely ask what matters to you and listened attentively at every encounter with individuals and their family members, not just on the assessment of the patient when they enter the hospital through the ED or electively admitted, but at every encounter throughout the day. What's important to you that we accomplished today? What are you worried about when you go home? What's important to you? What are you worried about? Those deeper questions to help us understand how we can meet their needs more comprehensively. What will we learn? How might this understanding enhance our partnerships with patients and their family members? We think there's great merit in exploring this within your organizations.